Snoring therapy and sleep apnea therapy has become a big topic in dentistry, and it's becoming almost like a routine, appliance therapy, a routine approach for us. Many dentists have started to work with sleep centers and sleep specialists and trying to help patients with options to help them sleep. And it is interesting how it's not necessarily the patient that we're helping, it's actually the spouse that we're helping, because the spouse is the one that can't stand sleeping, when they've got the snorer beside them. And so, sometimes it's the spouse saying, "Can you help my husband?" And so in doing that, basically we talk about whether the patient has had a sleep study, because that's something we encourage, the sleep study. And then if the sleep study basically summarizes that it's not just a snoring problem, by all means that's a simple, there's a couple of different appliances we use for treating snoring. And then when it comes to actually having apneic events to where breathing can stop, that has a huge effect on cardiovascular health, weight control. There's all sorts of medical considerations there. And so, if we can help a patient from with their sleep apnea, then certainly patients can appreciate that, because many patients are to the point where they're using CPAPs, which are the large machines that flush oxygen into the lungs, and that can be a very big inconvenience for a patient, especially when they're traveling, and so we've had patients come in and been using a CPAP for many years, and if we can just say, well, do you want to try something different? And many times they're eager because they've been having to deal with this inconvenience of this large machine in their mouth. We've been able to sort of help those patients transition from a CPAP to a snore appliance, and with success, really. And so that's a very nice thing to be able to offer, a patient.